studio is Dr. Kirsten
Okay. Let me
AWORI, one
call.
of the doctors who are in the Surgical
Okay.
Society of Kenya.
That's
Now,
let
those
me
people are
call you
good-hearted
like in.
people who give
Uh,
free surgery to needy people. Thank you so much for
uh,
coming.
Thank you.
It's great to have you.
Pleasure.
All right. We
okay.
can start. Just briefly tell us what Surgical Society of Kenya is all about.
Uh,
Okay,
all
Surgical
right.
Society of Kenya
Okay.
was launched in 1989, initially as an association for just fellowship of surgeons, to try and bring surgeons together socially, because our lives are usually full of medical drama, surgical drama. And after some time, with the number of surgeons increasing in the country by around 2,000, we had to reinvigorate the society. These are senior colleagues then who are surgeons. So we sat down and felt that we need to do a little more than just sitting together and probably coming together. So around 2001, that's when the initiative of having surgical camps in the country was started. And this was just to make sure that those Kenyans who are in probably inaccessible areas, and those who probably can't afford to come to places where specialized surgical care is available, will be able to reach out to them. And so a few senior colleagues then would organize, collect some funds from themselves and a few well-wishers and hospitals, and then they would travel with the help of organizations like AMREF to various parts of the country. So over the years, this has been evolving, and perhaps the biggest challenge we've been having is that surgical training is quite a long process, and we are not able to cope with the acceptable ratios of surgeons to the population. And secondly, I think poverty still remains a major problem in this country. There are efforts by the government to try and improve healthcare status in the country, but again, you know the whole economy issue. So we have many Kenyans out there who either do not know that such services may be available and can be rendered by local surgeons, others can't afford it altogether, and we try as much as possible to try and reach out to them. Yes.
How has the impact been for the people who you've been able to access in different parts of the country? I mean, how has the impact been?
It's quite encouraging. Yeah, but I would say that, you know, disease is a continuing burden. You can sort out a problem with one person, another one emerges. So you can't really just say when you go once and treat or operate on one person, you may have changed their life dramatically. It's a story to tell by whoever you assisted, but there will be others, therefore, who need such services. So that's why I feel that you need to have something that is sustainable. Yeah.
Okay. I mean, looking at our country, healthcare is expensive for so many people across the board. And I mean, an organization like yours is, of course, doing something that is extremely positive and something for Kenyans to look forward to. What inspires the surgeons behind SSK? What inspires them?
Okay, SSK being an umbrella organization of all the surgeons of various specialties in the country, you know, we usually say, you work in a very depressing environment. It's not like you sit around and enjoy the environment. People are crying, people have problems, others you want to help. You have the expertise, but you don't have the equipment, you don't have supportive environment. So those are challenges. So what you do is, in our interaction in various workplaces with various patients, you come to appreciate the need of such services. So we would have to sit down. Like now, what we do is, we've not had a very positive response from the corporate world when it comes to some of these medical issues. So sometimes you just have to go back to the members and say, why can't you contribute this percentage of the annual subscription towards funding our movements in the annual surgical camps? So that is an initiative that we thought about. We are Kenyans, we have relatives, you may be staying here back in your rural place. There are people who need help. You have to liaise with maybe one of your colleagues who works there. So it's the need that being a Kenyan, you actually see that you're doing something at least to make your country move forward.
All right.
Yeah.
So basically, I mean, for people to understand it more, SSK is about giving free surgical procedures or surgeries to people who are in need?
We are more than that. It's a professional organization. We have a role towards, one, making sure that the members are up to date with the current surgical practice, and this usually involves hosting of annual conferences, which is mandatory by the medical board, that you have to keep up to date with your practice. So that's one of the mandate. The other mandate is to look into the social welfare of the surgeons. Really not really as in you are sick, we're doing for you ABCD, but just stay together, appreciate each other, share your challenges in the various areas of the country. Then the other thing we're also pursuing, as you may have noticed, the emerging training institutions. And if you check in the advanced countries, they have more like a collegiate system where if somebody's training, let's say, you need to have to work to, you can't say I'm a graduate of this place, you're all surgeons. So you need an umbrella body where you can sit down, share your views. That's one of the other mandates, and we, in trying to strengthen that, we also try and make sure that at least we see with the current constitutional dispensation if we can be involved in the training mandate, so that we see also what is the quality of training.
All right, someone might ask, I mean, where are you, all over Kenya, are you in just the major cities of Nairobi, Mombasa, and Kisumu, or are you at the grassroots level? Are we talking about Turkana? Are we talking about places which are not usually reached by services, with services?
We are, surgeons are now all over the country. As much as majority may be in the major cities, but at least there has been a concerted effort by the ministry to have surgeons in every other places. Like this year we have the surgical camp, Lodwar, Otum, Kapenguria, and those places we already have surgeons who are resident. And basically what the camp is all about is that there are problems related to facilities. Because if you're in a place like Lodwar, you may want to operate on certain complex areas but you don't have the backup. So what it involves is that when you go to before you go to the camp, somebody has to be there, screen the patient, identify the need, the challenges, what cases can you handle, which cases can you advise the mechanisms of having them brought to, let's say, Nairobi for further attention. How do you mobilize resources to try and assist this person? And then when you go on the ground, we usually get a lot of support from mainly the hospitals. And you realize that hospitals work with budgets. So the support is mainly technical, where you're given nurses to support you, you're given equipment here for specialized surgeries. But again, you have to carry that equipment back with you. Yeah. So there are surgeries that would take place routinely in the hospitals, in the rural areas, or in the marginal areas. But then you also need to make sure that those patients who maybe need a little complex surgery, can you reach them, try and sort it out, and then follow up. We rely on our members who are actually on the ground.
And when you're on the ground, I mean, how do you determine this one is a needy case, this one needs urgent attention? I mean, how do you come to have a list of who you're going to help, who does not need it so much than the other?
Okay, screening. And this is done like now, there's already screening taking place for the camp, which will take place
in the country?
No, what we do is we move around. Actually, the biggest challenge has been the resources, because our vision would be to have this as a continuous process in various parts of the country. But again, you get limited by resources. So if I have the resources and I can actually be sending, for example, various members of different specialties to an area, you don't have to wait and do it annually once over a number of days, like 3-4 days. So that has been the challenge, and that's why we are looking for ways in which we can reach out to the corporate world. And last Friday, on 24th, we had a fundraising dinner and launching our foundation, because we felt that, when you just feel amorphous, people really don't trust amorphous institutions with their money. And while our own accord, raising money from our own pockets. We felt that some of the people who have been helping us are probably, if they're corporates, if you're going to an area like Mombasa, you may find like Kenya Postal Authority says, you're in Mombasa, we'll chip in. If you go to Northeastern, like last year we're in Northeastern, the local MPs, some of them will say, you are helping our people, they chip in. Some areas people don't see the need, but still there are Kenyans who need the service. So when we are launching that foundation, we're looking into a way in which we can have something sustainable. If you have a pool of resources, you can invest in it and then plan. You have members on the ground, they'll tell you, we have this case, how do we sort it out? Do you have this person to come all the way to Nairobi? Can you get somebody to come down and operate on it? Because the skill is there. So just mobilizing the other necessary resources.
What was your most memorable experience as a doctor, as a surgeon? Which one can you remember? Which one stands out to you?
I'll speak personally because I do bone surgery. And it feels, when somebody has not been walking for a long time, there are a lot of road traffic accidents in this country. You go to a place, you find somebody has been immobilized for a long time, and they hear you around. We'll get some of the implants here and there. Some implants are very expensive, the others you can mobilize and get. You go, you operate on this person, they're followed up by colleagues on the ground. After a while, somebody walks up, they're able to fend for themselves. And it's even more encouraging if somebody was a breadwinner, was immobilized, putting the whole family down, and then all of a sudden at least they can fend for themselves. It's quite inspiring.
And you usually have so many of those stories.
Yeah, we have. Even when we're launching the foundation, we had some of our previous beneficiaries just telling their stories of how this has changed their lives.
Okay. Yeah. And where would you want to see SSK go to?
The professional mandate probably is not a subject what I came to discuss here. I'm looking at a scenario where Kenyans appreciate that we have the expertise available in this country. The main limitation we're having is investment in the supporting technical environment, because medicine, surgery to be specific, is quite capital intensive, and somebody has to invest in it. We spend a lot of money in medical tourism, a lot of millions of shillings, actually billions of shillings are spent. India, South Africa, people come up with interesting stories about how this happened in India. Here people are going around, nothing was happening. So when we have an umbrella organization, we have a forum where somebody can share whatever tribulations they have. You can see into mechanism, direct the person, maybe you benefit in this way without just having to think that if I have this thing, I'm going to India, I'm going to South Africa, some people go to the UK, etc. So that would be a forum through which Kenyans can source. If we tell you, fine, we haven't reached the capacity to offer you this specialized service, that's different. But majority of Kenyans are not about specialized service, just the basic service. And just to move this country to the next level, we're not talking about high-tech stuff. We're just talking about basic surgical care. And that's what we're aiming at our level of development of the country.
Okay.
Yeah.
And how can Kenyans chip in? I mean, people are watching and they are wondering, how do we help?
Okay, one, it's at individual level, and that's why I was talking about creation of a foundation with strategies clear to anybody who wants to support the cause. We are approachable on our website, sskenya.org. You can be able to reach us on that. You can follow us on Twitter, Facebook, and that's at individual level. And corporate level, we also have our events organizer, Iris